morning, one and all. It's an immense pleasure to extend to you all a very warm welcome on behalf of IEEE Education Society Kerala chapter to today's interactive session, Recharge Without Charge, organized in association with Mawar Charitable Trust. The specific objective of this session is to provide an insight into the various ways of handling daily life stress. In case of inquiries during the session, please feel free to raise the question chat box. To begin with the session, we request Rita Menon, co-founder of My Outlet for her speech. Ma'am, please.
Thank you, Veena. Good afternoon, everyone. Today, first and foremost, thank for coming in the afternoon to attend our session. Let me tell you a little bit about Ms. Suraj, who is our webinar speaker for the day. She's a mental health and wellness professional who's passionate in empowering the next generation and fine-tuning their being as human beings. An active crusader, mentor, and founder of a non-profit organization which works towards child protection, child safety, upholding child rights through her NGO Swaraksha, which is based in Kochi. And it is an initiative against child sexual abuse. She is Vice President of Kerala Mental Health Council, a member of Kerala Clinical Counselor Association, and founder of Edsoc. She's also the recipient of Bhumika Unsung Heroes Awards and was recognized by Star Network's Year 2020 for contributing towards wellness and social work throughout the pandemic. Thank you so much, ma'am, for agreeing to the session for us. Over to you.
Thank you so much, dear Srila. Good afternoon, students. I will be addressing all the IEEE students. So let me first begin by extending my gratitude to IEEE Education Society and Mind Empowered, especially to Maya and Srila for calling me over. And as today's topic indicates, it's about coping up with, stress. And so before we go ahead with stress management or knowing what is stress, I would like to just bring your attention to mental health, which is gaining as much importance as physical health. So I'll just like to brief on mental health a bit. Hope that's fine, Srila. Okay. Am I audible?
Yes, you are.
Okay. I am unable to see the Google Meet or any of those screens or the chat windows because my screen is, on the slide share mode. So if anything is there, please feel free to, remind me or alert me or whatever. Okay.
Sure, ma'am.
Okay. Thank you. Okay. So the first slide indicates that mental health is as important as our physical health. We would have read or we would have heard or we would be aware that mental health is as much gaining as much importance as physical health. But how do we give attention to mental health? That is a very important question which often comes up. So basically what I've put here on the slide is the cognitive triangle, as we call it. The thoughts, the emotions, and the behavior. That is the thoughts, feelings, and our acts, which comes inside this triangle. Simply put, it indicates how our thoughts change the way we feel, which in turn affects our action, right? And the thoughts will again go back, and it's like a cycle. The cycle just goes on. And when we speak about mental health, we are actually talking about the holistic health, actually, the emotional, the psychological, and the social aspects of well-being is what we are talking about. And basically it also determines how we handle the stressors around us, the how much we can relate to others, our interpersonal, intrapersonal skills, the relationships we handle, the choices we make. All these will come under mental health. So this is just to give you an awareness for those who do not know, those who have not thought about it. You can start giving it a thought right now. And to understand mental health more, there is a slide which says that mental health is something everyone has. Because why I have put this slide is because mostly mental health and mental illness are often confused in a confusing manner, or it is understood or misinterpreted as one thing which is not, which is what I wanted to address first. So mental health is something which is part of us as much as our physical health is. It's just part of being human and it needs to be addressed. So when we think about all the stigmas which concerning mental health, or it's often people do not come out and discuss these topics much. So last year you would have been shocked hearing Sushant Singh's it was not last year, few years back. So until then, nobody gave much importance to mental health, or it was not discussed. And then there was this sudden wave after he was gone, as to what would have happened. So there was another picture which was going on, taking rounds, where one girl had just put up a birthday picture, and the next day the girl has committed suicide. So people had started wondering, how can one be so happy? How can one put a picture like this the day previous to attempting a suicide? So what we wanted to say is that there is no phase as such for mental illness, or when there is a mental health issue. That's what we wanted to say. And mental health is never a sign of weakness or shame. It needs unashamed conversations, and it is totally different from mental illness. I'll of course take you through the what a mental illness is, for sure. So when we speak about mental health, it is not, it's a state of well-being, of course, but it's not absence of diseases, but the way we can cope up well, we can function well, we can respond appropriately, and we can perform normally is that is when you say that your mental health is fine. When your functioning is affected, then that means that it needs attention and care. So uh, that's what I wanted to highlight on this before going into the stress management part of it. And yeah, this is just a general information regarding COVID. When the pandemic had started, there were many people who were having, comorbid health conditions, and this placed them at a more socio-economic disadvantage. People who are having severe illnesses, who are having pre-existing mental health issues, maybe they were not aware of it, maybe they had not addressed it, and those were people who had suffered a lot, and they, this associated with a higher level of physical distress and a lower level of life satisfaction. So that is um, yeah, so that's the comorbid. Those people were considered to be vulnerable from a mental health perspective when the pandemic had started. So coming to mental health and mental illness, so this is how you differentiate. um, so mental illness, when we talk about that, it is a serious disorder affecting one's behavior, thinking, and feeling, or when there's a problem for a person to function in work related activities, socially, in the family, occupation, all these things. And it also depends upon the length and duration and the severity of the disability. So this is how you distinguish these three. Mental health issues is when you have a diminished ability to perform, and it interferes kind of with the your day-to-day functioning. That's when you call. And this includes mood issues also. Mood disorders are also placed under mental illness. So I hope this is not too much of a you don't have trouble understanding this here. So I'll move on to the next slide. Yeah, what is mental illness? So when we say in general that I am depressed, actually maybe it's a temporary state of mind. The person may not be having a totally depressive mindset forever, like not throughout the year or anything, but maybe for a very short period of time, maybe a part of a day, then you do not call it as a mental illness. Only if it is, lasting for more than a month or 3 months, 2 months, or continuously it's persisting, enduring for 6 months, then you call it a mental illness. Nowadays, we have heard people using this term. Just I have heard kids also saying that I am depressed, I am stressed. They often say all these things. That's because the children are not being sometimes taught to label their emotions, or to vocalize or verbalize what they are feeling. Then it leads to confusion. So they use the commonly used term, such as I am depressed and all. But you should not be using such terms, because it's actually a mental illness which needs a proper diagnosis and a proper assessment by a mental health professional, right? So these are some of the warning signs which is given here. And here we are talking about persistent or enduring state. It's not a temporary one. So that is the difference. The way you diagnose, the way it will be dependent upon the severity and duration, the length of the course of the disease. That's what we are talking about here. Coming to stress. Okay, so there is a diagnostic definition here, and also how we relate to stress as a layman. So stress is nothing but a normal human reaction that happens to everyone. So our body is designed in such a manner that it's always ready to experience. We are open to experiencing the stress and reacting to it. So a situation where we feel we cannot manage or control ourselves, that is what we call normally as a stress or a stress response, a feeling of emotional, psychological pain, strain, and pressure, as it is put down here. Okay. And knowing the symptoms of stress. So these are some of the symptoms that have been put down here. So when we talk about the symptoms, we can talk about the physical ones, like you having a headache, having difficulty sleeping, muscle pain, having problems with digestion, the gut tissues, BP. All these things can be some of the physical effects. And emotional effects can be mood related ones. Maybe you feeling irritable, restlessness, or lack of concentration, sadness, which is again coming to the mood issues. So all these things can also be the emotional effects. And sometimes you have signs, right? You feel sometimes you feel panicky, you feel excessive worry, you feel fear, you feel you are under pressure. And sometimes people, you know um, you go ahead and what go ahead with drinks, drugs, etc., as a means to cope up with stress. Sometimes it is they overeat, sometimes they smoke it out, and sometimes they withdraw from everything. So these are all ways in which the stress affects us, and mostly it is felt in the form of physical sensations in the body. Yeah, so here I have just simply put it using a Google image. This is how it affects the parasympathetic nervous system and the sympathetic nervous system. So when there is a stressful situation, immediately the body prepares to either fight or flight, to take away from the scene, or to fight it, whatever the situation is. So the system will actually prepare the body for the incoming onslaught, or whatever the stressful situation is. Sometimes how do you feel stress? Um, can I open the question to all of you? Can you tell me some of the ways in which you have felt, you have reacted? Means your body has reacted to stress, like for example, increased heartbeat, anything? Did you all fall asleep after eating nice lunch? Because I've come in the afternoon and you're all in a relaxed mode. You have not felt stress at all in your lifetime?
When we get afraid.
Yeah, okay, frightened. Then anyone else? I'm okay to talking in Malayalam also. Okay, I'm just carrying it on without asking you guys if you prefer a Manglish language or whatever. What is it that you want? Should I switch to Malayalam? നിങ്ങളെല്ലാരും ഉറങ്ങാണോ?
Ma'am, I think there are a few people who are non-Malayalis also, so I think it would be better if we stick
Okay.
to the English
Okay.
medium.
Okay. Yeah. So anybody else?
Hi, ma'am. Am I audible?
Yeah, you are.
Yeah, I'm Aisha. Usually, when I get stressed, my hands sweat very easily.
Yeah, that's there. Yes, the palms become cold and sweaty. Yes, you are right.
Then thirst or like
Yeah. Okay. Okay. Thank you so much, Aisha. Okay, so some sensations which you feel like, the pupils dilating, or as she said, sweat, like it can be on your forehead or on your palms or whatever. Sometimes you feel increased heart rate, and the breathing rhythm is disturbed. It's not the normal breathing rhythm. And sometimes what happens is that while the sympathetic nervous system prepares your body to fight or freeze or flight, um, parasympathetic nervous system actually calms you down. It prepares your body to take time, calm down, think, and restore your body function. So it slows the beats, it constricts the pupil, it constricts the airways, relaxes the uterus, urinary output becomes high, and all the normal things will be restored. So the sensory nervous system is the one which will make you, prepare you, and the other one will help you recover from such a stressful situation. So this is just another slide, stress induced changes in the nervous system. Actually, engineering students have a problem with understanding of medical terms. Do you have any such problems? I have a few cousins who are in IT. Then they will tell me, you please don't tell me anything related to medicine. Either we can't understand, or it's too boring and all that. So if the slide is too much for you, I'll just go ahead with the next one. Okay. So this is just the changes in the body, stress induced changes, that will commonly happen in the nervous system. It can even include missed periods, low sex drive, stomach ache, weakened immune system, lack of sleep, insomnia, headaches, heartburn, rapid breathing. So take a simple thing like insomnia. It can be like inability to fall asleep, stay asleep, or maybe you're waking up early in the morning, but we may not be aware, that we cannot, all this is part of insomnia only, but you may not be aware. You may be sleeping very late, you may be having difficulty falling asleep. So all these things will help you to increase your awareness level on what you can do. So again, another slide on the other things which we might skip, things like migraine. ഇപ്പൊ കോമൺ ആയിട്ട് ആൾക്കാർക്ക് ഉള്ളതല്ലേ ചെന്നിക്കുത്ത്, what we call as severe headaches which happens in the frontal areas between the eyebrows or under the eyes. It's a neurovascular disorder which affects the entire system. For example, we might not be aware that one of the causes can be stress, if you take migraines. So like that. And when it compares to cognitive functions, it can affect your judgment, your thinking capacity, or you may feel dizzy, or that is the sensation. And then it affects the way you eat, the way you sleep, and all these things. Sometimes you don't feel like talking to anybody. So these are all just ways in which it can affect you. All of these may not come for every person. Let's not generalize here, but these are felt like, that's how people feel. Okay, so coming to this, like, is stress helpful or harmful? We have seen kids coming and telling us mostly that stress is good for us, no ma'am, because it helps us, it helps us to prepare for the impending danger. The body responds with flight or fight response, and then it increases our, the way we react, our how we respond, and all that. So it's all correct. Okay, so while the body prepares yourself to face the stress, it also depends upon the level of stress that you're experiencing. Whether it is continuous stress, you are experiencing continuous stress for certain period of time, or is it discrete, how frequently you're experiencing it, and what is the intensity. So based on this, you can categorize stress into two parts. One, the acute stress, and the chronic stress. So acute stress, when we talk about acute stress will always have a sudden onset. So you will not have, you may not be able to realize, you may not understand immediately what it is. So when you are faced with a situation on which you have no control, you are actually feeling fright, and in such a situation, okay. But imagine a scenario where in a house a person is constantly fighting with the spouse, or another situation where there is a toxic work environment. So in the cases, what will happen, the stress will happen, there will be a sudden onset, and that is when we experience acute stress. Chronic will be when it happens long term, that is, it's happening continuously for a long period of time. Okay, so coming to the important part of it, how do we actually cope up with stress? That's what we need to understand. So, awareness is definitely the first step. Educate yourself and read more on how this happens, what is stress, how do you manage, what is the source, how does it happen, എവിടെ നിന്നാണ് നിങ്ങൾക്ക് സ്ട്രെസ്സിന്റെ സോഴ്സ് വരുന്നത് എന്നുള്ളതാണ്. അതായത് വീടാണോ, or the work environment, or the college environment, and find ways to stay clear. At times it's not possible when you don't have a control over the source, but what you can do is you can prioritize, you can draw boundaries. Okay, I'll come to all those things. Then second is the recognizing the signal. നമ്മുടെ ബോഡി തന്നെ കുറേ സിഗ്നൽസ് തരും അല്ലെ, തിങ്സ് ആർ നോട്ട് ഓക്കെ, യു ആർ ഫീലിംഗ് ദാറ്റ്, പെട്ടെന്ന് യു ആർ ഫീലിംഗ് എ പാൽപിറ്റേഷൻ, or sometimes you are feeling a panic attack kind of a thing. You want to lie down, you're suddenly you're feeling your hand is shaking, and the hyperventilation in the legs and all those things happening. You know that you are not okay, right? And the third thing is share the feelings. You are not alone. You can always share it with somebody who is ready to listen to you and who can understand you. Don't don't go to a point where you are breaking down. Okay, so don't be too hard on yourself. Being self-critical can also be really difficult. That okay, I'm way too far behind my work while others have gone ahead, and lot of negative thoughts which comes in, that can get really difficult, and it can cause issues. And also create a a network of friends to whom you can share your feelings. And then you have time management techniques which you can try, prioritizing. Being engineering students, I don't want to lecture more on that. Then you can try relaxation trainings. There are many ways of relaxation. One is the mindfulness based stress reduction, which I've put it in here. Mindfulness, I just love that theory of mindfulness. I don't know how many of you are aware. I'll anyway take you through that. Then finally is seeking medical support or mental health professional support, or whatever, whenever you feel like. So when seeking support is not a sign of weakness, but rather a feeling of strength. Because എത്ര പേർക്ക് തുറന്നു പറയാൻ പറ്റും, I'm going through something. Okay, shall I ask one question to all of you? How many of you don't feel reluctant to come out and tell that I'm not feeling okay right now, or there have been situations where I have have had a very difficult time coping up with something. ഭയങ്കര ബുദ്ധിമുട്ടല്ലേ അത് പറയാനായിട്ട്? So it takes immense strength to come out, but getting support is very important, right? Okay, so yeah, so there are different approaches. This is your takeaway. So how do you cope up with all the stress? There are three approaches which I've put here. One is action oriented, emotion oriented, and acceptance oriented. Go through each one of them. So these are some of the action oriented techniques, and I'm always in for the mindfulness technique. So mindfulness nu parna endana? Normally we ask this question to student and ask them to think over it. Is your mind full, full, or are you mindful? Adana question. Okay, I'm just putting this question before you so that you think about that for a second. നിങ്ങളുടെ മൈൻഡ് ഭയങ്കര ഫുള്ളായിട്ടാണ് ഇരിക്കുന്നത്. ഓ ഞങ്ങൾ ഉച്ചയ്ക്ക് വന്നിട്ട് ഈ മാം എന്തൊക്കെയാ പറയണേ, സ്ട്രെസ്സും അതും ഇതും ബോറടിച്ചിട്ട് വയ്യ. ഏതർ ദാറ്റ് ഓർ യുവർ മൈൻഡ് ഇസ് കോൺസ്റ്റന്റ്ലി റിവോൾവിംഗ്, തിങ്കിങ് സംതിങ്, എന്തെങ്കിലുമൊക്കെ ആലോചിച്ചുകൊണ്ടിരിക്കുകയാണോ, ഓർ you are mindful. If you're mindful, if I ask a question, you'll be able to answer, so that you can test for yourself. That will be the level of your mindfulness, which means that how much you are staying in the present. Okay, your self awareness is what I'm talking about. Mindfulness nu paranja adana, how much you are aware. If I ask you what did you eat in the morning, how many of you will be able to say immediately, like dosha, idli, puttu, or whatever, chapati, paratha, whatever? സോ അത് എത്ര പേർക്ക് പറയാൻ പറ്റും എന്നുള്ളതാണ് നമ്മൾ നോക്കുന്നത്. ഓർ ഇഫ് ഐ ആസ്ക് യു വാട്ട് ഡിഡ് യു വെയർ യെസ്റ്റർഡേ നൈറ്റ്, വാട്ട് കളർ ഡ്രസ് ഡിഡ് യു വെയർ, ഹാവ് യു നോട്ടീസ് ദ പ്ലാന്റ് അറൌണ്ട് യു, ഹൗ മെനി പ്ലാന്റ്സ് ആർ ദെയർ അറൌണ്ട് യുവർ ബിൽഡിംഗ് വെൻ യു ഗോ ഔട്ട്? ഇതൊക്കെ നമ്മൾ ശ്രദ്ധിക്കാറുണ്ടോ? ആർക്ക് സമയം, നമ്മൾ പോവും വരും അല്ലേ? സോ
I look around.
You look around. That's very good. That's very good. You have to. Yeah.
I noted in my diary.
Okay, really happy to hear a response. ഇല്ലെങ്കിൽ ഞാൻ പറയായിരുന്നു, like ever since COVID began, no, I've been speaking to a lot of students like through my NGO. അപ്പൊ I always see the video which is all switched off and all that. അപ്പൊ ഞാൻ വിചാരിക്കും ദൈവമേ ഞാൻ പാരനോർമൽ ആക്ടിവിറ്റി ക്ലാസ്സിലാണ് ഇരിക്കണേന്ന്. Because I can see whoever is on the other side. ഉച്ചയ്ക്കൊക്കെ ആകുമ്പോൾ കുട്ടികൾ ചിലപ്പോൾ കിടന്നിട്ടൊക്കെ ആയിരിക്കും അറ്റൻഡ് ചെയ്യുക. So it's difficult, right? Yeah, okay. So once in a while, one of you can unmute and respond. Okay. So thank you for that. So yeah, it's really good to pay attention to the present moment, because it helps us control our racing, repetitive, and non-productive thoughts. Okay, which is actually leading to the stressful situations at times. But at times, for example, imagine, or supposedly you were waiting for somebody to turn up, okay, or you were expecting a text from somebody, maybe a friend or a boyfriend or girlfriend or some relative, or it can be anybody. Okay, the text did not come, and then you start thinking what would have happened to the person. ഇനി വരുന്ന വഴിക്ക് എന്തെങ്കിലും സംഭവിച്ചിട്ടുണ്ടാവോ, any accident, or maybe the person doesn't love me, or why is she not coming on time, why is she keeping me wait, is she not interested in me, and the rumination starts, right? അങ്ങനെയല്ലേ നമുക്ക് തോട്ട് വരിക, and we think and we create a lot of thoughts, which self-created thoughts is what we will say. അല്ലേ? അപ്പം നമുക്ക് how do you change that? By purposefully or mindfully distracting yourself from the thoughts. That way you change your reaction by choosing to pay attention to what is occurring now at the present moment is how you will distract yourself constructively. Adana mindfulness parayna karyam. Okay, and all the other things, mindfulness actually uses yoga, meditation, and other techniques, like guided imagery, kore techniques in which is often being used in the MSBR classes, which will actually help you to cope up with the stress. Deep breathing, yes, of course, I'll give you a deep breathing technique towards the end of the session. Then all the physical distractions, positive distractions that you may use when you are in a group, college activities, or exercise, yoga, whatever. So when you involve in all that, it is productive activity which will actually put a small curb to the ruminative thoughts that you are having. Another very important another point is on about setting boundaries. പലപ്പോഴും നമ്മൾ ഒരു ബൗണ്ടറി വരയ്ക്കുമ്പോഴത്തേക്കും often we feel stressed sometimes because we cannot say no to certain people or to certain situations, right? നമ്മൾ എൻ്റെ ലൈഫിൽ അങ്ങനത്തെ സിറ്റുവേഷൻസ് ഫേസ് ചെയ്തിട്ടില്ലേ? സപ്പോസ് ഐ എം ഹാവിങ് എ വെരി ഫാൻസി കാർ ആൻഡ് ഐ എം ഓക്കെ ടു മൈ ഫ്രണ്ട്സ് ടേക്കിംഗ് ഇറ്റ്, എനിക്ക് വലിയ കുഴപ്പമൊന്നുമില്ല. ബട്ട് ദെൻ സംബഡി ഈസ് കമ്മിങ് ആൻഡ് ആസ്ക് മീ, മാം ക്യാൻ ഐ ടേക്ക് ഇറ്റ് ടുമോറോ, അല്ല എനിക്ക് വേണം, അനു എനിക്ക് തരുമോ എന്ന് ചോദിക്കുകയാണ്. ആൻഡ് ടുമോറോ ഐ ഡോണ്ട് വാണ്ട് ടു ഗിവ് ബിക്കോസ് ഐ ഹാവ് അതർ തിങ്, ബട്ട് ഐ കാൻ സേ എ നോ ടു ദാറ്റ് പേഴ്സൺ. പിന്നെ സ്ട്രെസ് ആയി, ഓ ഞാൻ എങ്ങനെയാണ്, how will I refuse this person? I'm just saying an example of a car. It can be anything. You cannot say no. So what sometimes people resort to passive aggressive techniques. So instead of that, what we can reinforce is assertion. Being assertive. You can be kind and say no. Ayyo naala pattilla, I'm very sorry, I can't lend it to you tomorrow, maybe another day you can take this, so it's not okay for you to take it tomorrow, I've got some. അങ്ങനെ നമ്മൾ കൈൻഡ് ആയിട്ട് അല്ല, you can be compassionate, but at the same time you can tell that it's not possible. So So അങ്ങനത്തെ ഒരു assertiveness ആണ് നമ്മൾ പ്രാക്ടീസ് ചെയ്യേണ്ടത്, which will also reduce the stress and also the relationship will not get affected. Time management, of course, is related to how constructively you manage the time, how you prioritize your goals and other things. And distraction is what I was mentioning all this while. Next one is management oriented techniques, emotion oriented techniques ആണ് affirmations, like positive affirmations in the law, positive statements that can help you to overcome all the self sabotaging thoughts that we have. Self sabotaging എന്ന് വെച്ചാൽ എന്താണ്, നമ്മളെ തന്നെ കുത്തി നോവിക്കുക അല്ലെ, ഐ എം യൂസ്ലെസ്, ഐ എം വർത്ത്ലെസ്, എന്നെ എന്തിനു കൊള്ളാം, അങ്ങനത്തെയൊക്കെയുള്ള തോട്ട്സ് നമുക്ക് ചിലപ്പോൾ വരില്ലേ. Somebody would have mentioned something and we would have gone by the opinion of that person and we would have taken it really hard on ourselves, and then it becomes self-sabotaging and negative thoughts. So in these cases, affirmations, positive affirmations can be really helpful. That's also we also use that in therapy very often. Guided imagery is also a relaxation technique which will involve asking a person to visualize positive, a peaceful or a happy setting, and adu bhayangara effect aanu. If you all have time, we can do a small imagery activity, paper and pen activity, if time permits, and if you all have paper and pen, we can do that. Okay, adu cheyan samayam undo enakku ariyilla, we'll just try. So that is how that is one of the techniques. And then you have the cognitive restructuring എന്ന് പറഞ്ഞു കഴിഞ്ഞാൽ നമ്മുടെ തോട്ട്സിനെ മാറ്റി മാറ്റി പിടിക്കുക എന്നുള്ളതാണ്. ഓക്കെ, സോ ദാറ്റ് ഇസ് ഓൾസോ പാർട്ട് ഓഫ് തെറാപ്പി. സിമ്പിൾ ആയിട്ട് പറഞ്ഞു കഴിഞ്ഞാൽ, ആൻഡ് ദെൻ യു ഹാവ് ദ ABC technique. ABC technique is nothing but there is an event which will be happening and we will be having certain thoughts or beliefs or anything related to that event, and then we act based on that. Okay, so when you question your thoughts, then you will be able to control the action, and avada namukku stressful situation കുറയ്ക്കാൻ പറ്റും. ഞാൻ ഇങ്ങനെ പറഞ്ഞ, if you have difficulty in comprehending this, I can just tell you an example. Suppose you're crossing the road and you saw a person on the opposite side. നിങ്ങൾ രണ്ടുപേരും you are crossing each other. You saw the person, you're trying to smile, the other person has seen you is what you feel, but is not looking at you, smiling at you, but then walks over and goes to the other end. അപ്പോൾ നല്ലതായിട്ട് അറിയുന്ന ആളാണ്, and you feel very bad about it. You feel unhappy, you feel stressed, you have a lot of questions. Why did that person not look at me? Or that person has seen me എന്നിട്ട് ചിരിച്ചിട്ടില്ല. That person did not smile, did not respond, did not. പിന്നെ thoughts ആയി അവിടെ, you feel very stressed. You are thinking about this for a long time. The person has meant a lot to you and ഇപ്പം മൈൻഡ് ചെയ്യുന്നില്ല, and then it's ruminating again. So in that case, question yourself, question your thought. What if the person has not seen you? ചിലപ്പോൾ കണ്ടിട്ടേ ഉണ്ടാവില്ലായിരിക്കും അല്ലേ. സോ ഇറ്റ്സ് ജസ്റ്റ് ദ വേ യു തിങ്ക്. ആൻഡ് അപ്പോൾ ആ നമ്മുടെ ബിലീഫ്സിനെ ക്വസ്റ്റ്യൻ ചെയ്യുന്ന ഒരു സംഭവത്തിനെയാണ് നമ്മൾ ABC ടെക്നിക്കിലൂടെ ചെയ്യുന്നത്. ഇറ്റ്സ് ആക്ച്വലി കോൾഡ് കോഗ്നിറ്റീവ് റീസ്ട്രക്ചറിങ്, ഓർ that's what we use in therapies like CBT. Okay, so this is all for chronic stress and the ways to cope up the stress. Then acceptance oriented is where you go into talk therapy and talk it out with a person who will give you a safe space to talk about all these things. Sometimes keeping a journal will help. Sometimes you have the resilience building activity is something which is new I have put here, which is nothing but the way you build your confidence, your awareness, your problem solving skills, your patience, your tolerance, adellamana adile varunathu resilience building. It will need, you have to work on it. It will not happen overnight, but slowly you will have to work over it and then come to a conclusion. But for a cherry or a stress in if you get a nice massage for yourself, or you go out, watch a movie or engage in some outdoor activity. Some people get our sound vibrations are bhayangara powerful ana, so some people get change get a change, positive change in their mood and other things by just listening to simple music. Some children actually told me, like during the pandemic when we were doing sessions for children, kore kuttiyala, they actually told me that they listen to some kind of a music before sleeping. YouTube la they listen so that they get sleep. അവർ അത്ര സ്ട്രെസ്ഡ് ആണ് ഓൺലൈൻ ക്ലാസ്സസ് എടുത്തെടുത്തിട്ട്. കുറെ കുട്ടികൾ അങ്ങനെയൊക്കെ പറഞ്ഞിട്ടുണ്ട്. So it's like there are many ways on de-stressing or the coping up with the stressors. So that's again the acceptance oriented technique. Okay, and I've just put some slides related to suicidal tendencies, how to identify the warning signs. So when somebody is talking about or having thoughts about death, somebody is searching for ways to end life, Google search ചെയ്ത് നോക്കുകയാണ്, or reading books or asking people about it, talking about feeling hopeless, or they feel they don't want to live എന്നുള്ള ഒരു സംസാരമൊക്കെ വരാണെങ്കിൽ, or they are in some kind of, they feel trapped, they feel worthless, helpless, all those feelings, all the negative emotions coming out, and they say that I am a burden to others. So അതൊക്കെയാണ് ഒരു കുറച്ച് പോയിന്റ്സ് ഇവിടെ ഇട്ടിരിക്കുന്നത്. They are like warning signs. ആ കേസിൽ definitely you have to help the person out. If the person is yourself, you have to come out and talk about it. Okay, yeah, this is the continuation of that. The person is using increased amount of alcohol or drugs, they are sleeping too little or too much, they are having a social withdrawal as we spoke about earlier, and somebody is having extreme rage or ഭയങ്കര റിവെഞ്ച് മെൻറ്റാലിറ്റി അല്ലെങ്കിൽ ഭയങ്കര മൂഡ് സ്വിങ്സ്, അങ്ങനെയൊക്കെ വരുമ്പോഴും നമ്മൾ we have to identify that this is not okay, and especially when it is affecting the activities of daily living. So these are some simple techniques which we can do. You can just be a listener. You don't ask for any questions, don't probe or don't judge. Don't say that നിനക്ക് വേറെ പണിയൊന്നുമില്ലേ, അങ്ങനെ ഒരിക്കലും പറയരുത്. That's like rubbing on the wound. So never do that, because we do not know what the other person is going through, what is in his mind, what thoughts he are having. So what we can do is being supportive and give some hope, offering help by asking ഞാൻ എന്താണ് ചെയ്യേണ്ടത്, how can I help you എന്നുള്ള കാര്യം ചോദിക്കാം. Okay, and then they have put like building a contract by asking, will you promise me not to kill yourself till I find a help for you. So this is what you can do immediately. This is the crisis plan for only in those cases where the person is having a suicidal thought or an ideation. Okay, then as this I think we have already discussed about all these things. Calling and talking to a mental health professional or counselor or an expert can definitely help. Don't rely too much on the information that is available in the internet, especially if the source is unreliable, or if it cannot be trusted. Nowadays you have a lot of information available in the internet, too much ആണ്. So we do not know that ഇതിൽ എന്തൊക്കെയാണ് കറക്റ്റ് എന്തൊക്കെയാണ് wrong എന്നുള്ളത് നമുക്കറിയില്ല. Yeah, I just wanted to try one of the breathing techniques if you all are up to it, but I will just want you to open up your, like video on cheyandi varum. So I'll give you some time to think about it. We can just do 478 breathing if you are all up to it. Okay, and you can practice this. 478 is a very powerful method of, it's a breathing technique which is often used where you become aware of your breath, that is the breathing, as well as you'll also be aware, or you will also be counting, so you are mindfully distracting yourself. And then, so if you are all in for this, we can do that. We still have time. Yes, okay, Maya is nodding.
Actually, there might be some questions. Do you want to take the questions first, or you want to do the exercise first? How do you want to go about it, Anu?
Anything is fine.
Okay. So actually, just before the questions, there's something because this is IEEE branch. Some of you know about Mind Empowered, some of you don't. So I have a very short video to play about Mind Empowered. It's hardly a minute or two. So we'll go through that and then we'll go to the questions round. So here you go. Thank you. Thank you so much for that. Thank you for that time. Any questions, guys? You can please either unmute yourself, you can put it in chat, you can please ask any questions, and Anu ma'am will surely answer. Thank you for that. You can ask any specific questions you have for, stress management during exams or interviews, or how you want to deal with things. This is your chance.
I wanted to ask about assignments. Because submitting assignments is really stressful for me. Can, can you please suggest any stress relief methods for that?
Hi, Arul. What was that question? You feel stressed when it comes to your submitting your assignments.
Yes,
Okay, so what do you experience actually?
I became angry that time.
Okay, you are not able to um, write the assignments, or where was the struggle? Like planning to do the assignment, like setting time for that, or every day on a struggle?
Mm, it is about the time because I can't write it fast. That
Okay, you
when
can't
I
write fast. That
I
is your
will
struggle,
write
right?
it really slow, and I start doing when it is night time also.
Okay,
Because of that,
okay.
also I feel sleepy that time. Then I am really angry.
Okay. So you try to start your assignments by night time because that is only time you're free. You don't have any other time, the entire day.
Not, but I only remember about the assignments when at the night time. That the
Hmm.
rest of the time I'm doing from I think
Okay.
6 to 8. I will be studying and all, but I don't do assignments from that time. Then I think about assignments before I sleep.
Okay. Okay. So, see, mostly when we are active, no, when we are doing a lot of things, when our mind is stuffed, so we often forget when it is cluttered. That is the right word. So then, sometimes we tend to forget or not remember what is to be done and all that. So what we can do is we can constantly put reminders. Okay. Either you can put you do you use this sticky notepads at home, like any kind of കുറച്ച് കളർഫുൾ ആയിട്ടുള്ള sticky notepads ഇല്ലേ,
Yeah,
all those, yeah.
I used it now. I don't use when I
Yeah,
it is over now, so I don't use it.
Do you have a feeling that it is only for small children?
No, I don't feel like that.
Okay. Okay, so then there is no problem. You can just take some colorful sticky notes and put it all around. Okay, in your room. Nobody is going to bother, but you're going to benefit only from that. So keep as many reminders as possible. And if you're a person who is watching a lot of videos in phone, if you use phone also, you can keep a reminder or an alarm clock in that. So you can better manage that thing. The here the problem is that when we tend to do too many things, the mind is often cluttered with a lot of things. So we are not prioritizing what is immediately needed. So you can prioritize. You can also have make a journal, like as you do the diary writing and all, you can have a journal and you can write it in that also, like in the what is the first work that has to be given priority, and then the next, and then the next. So those things which are okay to be postponed slightly to the next day or even to the weekend, you put it down, and the one which needs to be given importance, you place it high. Okay, and sticky notepads is a easy way of grabbing your attention, and so that you are reminded of okay, there is such and such thing which I need to do, which I need to complete before that time. So that is how you can manage. It's one easier way. Okay, can you try that?
Okay, ma'am. I will. Sure.
Okay, thank you.
If anyone else having any doubts, please do feel free to put it up in the chat or maybe unmute yourself and ask to Anu ma'am. Thank you, ma'am, for your response.
Hello. Good afternoon. Can you hear me?
Yes.
Okay, so I'm Zada, and my grandmother has been having some anxiety issues lately.
Okay.
So she went to the doctor, and they recommended a psychologist. I'm sorry, a psychiatrist, but she is not willing to go and see the psychiatrist after that first session. She believes that all these stress are normal in people's life, and being a little aware of mental health issues, when I try to tell her, she is not, she doesn't want to go for many more sessions to, better herself. Even others in my surrounding, they also tell them it's not important. You will get addicted to these pills and things like that. So what do I do in such a situation when people don't understand, or
Okay.
make themselves aware of this situation?
Hmm. Yeah, thank you, Sada, for the question. Actually, this can be very daunting because it's mental health issues are not often addressed, and people do not have the as many insights on this. Now it is just gathering momentum, and with NGOs like Maya's or maybe our Swaraksha, we are all working hand in hand. Our mental health council to spread and remove the social stigma. It's not easy, we know that, and even sometimes it can be met with contempt. And here in your grandma's case, we do not know what kind of experience she had with the doctor. So maybe you can ask her more about that. So where is she feeling uncomfortable? What is the thing that is making her uncomfortable? Is it the drug? Is it the allopathic medication? Or if it is, then you can give her more options like the alternative treatment methods. Like there are homeo doctors. We have one Vinod Joseph doctor in our panel also, who is a homeopathic physician, and he caters to mental health issues. Okay, so there are a lot of people who have been to him, and they have, some people don't like allopathy. It's one person's that's up to that person. So we cannot force them. If the person dislikes allopathy, we cannot force them to have allopathic medication. So that is one thing. So you can just be around. She'll come to you. It will take some time. Even when we are trying to change the mindsets of people in a society, it's not easy. It cannot happen overnight. It will take a lot of time. You have to be really patient and consistent with this thing, to achieve the desired result. But she might come around, and if you can kindly listen to her more, ask her what is the one thing that she's facing, why is she feeling like this, why she doesn't want to open up, or then you can ask her if she's ready to talk to a psychologist. Instead of, she can have her medicines, but at the same time, you can address the issues in a more, where there is a space for her to talk elaborately about issues, where she can have multiple sessions, like go once in a week or something like that. Maybe she can try all those, a combination of all these things. And then you can keep saying all these things around to her and again without accepting defeat. I know it's a very difficult situation, but yeah, you can make her aware. There are plenty of videos, but take good ones, which talk about mental health. Like I said, the source, reliability of a source is a very important thing. So when I talk about this, I suddenly remembered that there was a girl who used to come to me. We used to have talk sessions like every once in a week, and she was doing very well. Then suddenly one fine day, she seemed very down, and she came and told me that I'm not quite okay. Then I asked what happened to you, because she was feeling really good. നല്ല മാറ്റം ഉണ്ടായിരുന്ന കുട്ടിയാണ്. Suddenly she came and asked me. Then she told me that, ma'am, I think I have maladaptive daydreaming, is what she said. So I had to listen very hard, and I asked her, what is it? Then she said it's maladaptive daydreaming. So I was just trying to, you know, um, process the word myself for some time. Then I asked her, from where did you get this and why do you feel that you have this? So then she said that I saw it in a YouTube video and I strongly feel I have this, because she's actually a very artistic person. She's creative, she uses a lot of her imagination, and she's a thinker. So basically she spends a lot of time thinking, and daydreaming, fantasizing, which is not a bad thing at all. But then only if it is affecting her functional living, it will become maladaptive, right? So then it has not gone to such a point, but she strongly believes that she has this. So that is the effect of, watching a video, or if it's not a reliable source, these things can also happen. So you have to be very careful from where you're taking the video, what is the source and all. Okay, so you can spread awareness in that manner also.
Okay, ma'am. Thank you so much.
Okay, Sada.
Thank you so much, ma'am, for your wonderful session. I think
Thank you, Maya.
yeah, no, really. I always, I mean, you've come to our sessions, and I always feel you really give such insights which can really help students so well. So thank you so much for your time, and we'll be having our next session in continuation with Femi, Dr. Femi. I think Dr. Femi is also
Sure.
here. So thank you, Anu ma'am. Thank you so much for all your time.
It's my
Thank you,
pleasure.
Anu
Thank
ma'am.
you so much.
Thank you very much, Anu ma'am, for your valuable information on stress management. It will definitely help us in future.
Thank you so much, Veena.
Actually, I would like to request everyone to turn on their cameras for a virtual picture. Everyone, please turn on your camera if you are comfortable. I hope I shall be dealing with the virtual picture.
Yeah, in 1, 2, 3, IEEE. Cool, it's done.
Thank you. So for next, we are having an interactive Q&A session. You guys can raise your queries through the chat box, and Dr. Femi Abdulla, psychiatrist at Futureace Hospital, Kochi, will be addressing all of your concerns.
So how we will be going about it is that we had sent across a Google form before for anonymity in case anybody had any queries, and we got a couple of queries, not a couple, actually we got about 16 queries in them. So we will first be taking up those queries. Ma'am will be answering them first, and then later on, if the time permits, you can put your queries on the chat box, and then we will answer them. Fine with me, ma'am?
Yeah, no problem.
Okay. Just give me a moment while I share the PowerPoint. But before that, I would like to introduce Femi, ma'am. Dr. Femi Abdulla is an MBBS graduate from MES Medical College under Calcutta University. She further did her MD Psychiatry from Amrita Institute of Medical Sciences. She has worked in multiple academic institutions, private and government hospitals across Kerala. She's a psychiatrist by passion and is currently working in Futureace Hospital, Kochi. Just give me one moment and I'll open the PowerPoint, please. Is it visible?
Yeah.
Okay. Ma'am, I'll start with the questions now.
Yeah, no problem.
Yes. Okay.
Feels like a viva.
I'm so sorry. I didn't mean to sound it that way.
Just joke.
Okay. So the first question is, how can we become less anxious about our future?
Basically, future is a little worrisome because you don't know what is coming next. Just like I don't know what my next question is. So basically, you have to write down in specific what you're worried about. Like earlier, Miss Anu had mentioned about writing your worries. It really helps because sometimes you tend to go on overthinking about certain things, like uh, if in the future that you don't know about, that you just keep worrying about unnecessary things. So try to pinpoint exactly what is it that you're worrying, so then you will realize whether it is valid or not valid. Okay, once you write it down, you will be able to figure out what is it that what exactly is your problem. Sometimes you will be sitting and thinking, oh, will my exams go properly, will I do well, will I do well? There's no point worrying, will I do well? So the problem there is, okay, you're worried about your exam. Yes, when you write it down, you will realize, yes, what do I have to do? I have to start working towards it. So generally writing it down helps you figure out what the underlying problem is. Like my previous speaker had said, your mind is generally very cluttered, and it'll writing it down generally helps you to focus on that particular issue at that particular point, and then work towards that solution. If you're worried about your exam, buckle up and start studying. Okay, and find a mentor. If you can't find a solution, like sometimes it's your career that you're worried about, you don't know what to do next. Find a mentor who can help you out, to work out those solutions. If you can't do it on your own, mentor can be someone much older to you. It can be a friend who is there to help you out, sort out your clutter. And most importantly, what I started off, stop worrying about uncertainties in the future, which you can't do anything about. So
Okay.
yeah, I guess that kind of answers.
Yes. Okay, the next question is, I'm depressed most of the time. How do I deal with this?
Okay. Depression again is slightly tricky when you say I am depressed. Then comes the question that how do you know you're depressed? Usually, like again, Miss Anu had said previously, most of the terms like depression is casually thrown around. Even 6-year-olds come and tell, "Ma'am, I'm depressed." I don't even know how the kid knows whether to spell depression, but casually, oh, I'm very bored, I'm very depressed. But sometimes it shouldn't be thrown around casually. I'll help you understand how to differentiate between depression and normal sadness first. Okay, because that's where we get confused most commonly. Generally, we have a breakup. Everybody thinks, I can't get out of it. I'm sad for the last 2-3 days. I'm in depression. No, it is very normal that you have a breakup. You are sad. You're supposed to be sad. You just lost someone who's very important to you. Just like you didn't do well in an exam, you will definitely be sad. But in depression, it is a pervasive sadness where it lasts for minimum of 2 weeks. More than 2 weeks, there's nothing, you're not feeling any other emotion besides sadness throughout those 2 weeks, or predominantly for those 2 weeks. You don't enjoy a joke, you can't read a book, you can't see your series on Netflix and enjoy it. You're just like automated. You don't enjoy the jokes on Friends. You can't appreciate anything. Your friend cracks a joke, you don't want to hang out with your friends, you don't want to eat, you don't want to take a bath, you don't want to get out of bed. So all this kind of shows that you're depressed as opposed to sadness. Okay, now if it is mild depression or just sadness, I'll tell you a few tips to get by it. But if it is, slightly above that, you definitely have to get help, be it therapy or medication, whatever works. Moderate to severe depression requires medicines along with therapy, definitely has a better effect. But yes, you will require. So how do we differentiate? How do we go about helping ourselves when we are on the lower spectrum? But yes, we're not happy with ourselves. Okay. So it's like you can, start off by small things at a time. Like, work on one day at a time, that moment at a time. Okay, if today was bad, tomorrow need not be a thought you can work on, because generally when we go into these low moods and negative thinking styles, we have what is called as hopelessness. We look at our future and we can't see anything to look forward to. You think today is bad, tomorrow is going to be just the same. So you can try to work on that thought first. Okay, today I put aside. Okay, and stop overgeneralizing. Okay, overgeneralization is you know cognitive error. That's a medical terminology. How do we put it simply? Is a thinking style that is not that is maladaptive, that doesn't fit properly with being happy, or so what when we are in having negative emotions, what we generally, we have one bad day and think every day is bad. Or you don't see what went positive in that day. Maybe you can try writing about what went well in that day. You can sit down just before going to bed, take a journal and write. Today, yes, today I met an old friend. Yes, that was a good thing. Mom made biryani. That was a good thing. So there might be so many things. It might be really small as opposed to your breakup, but yes, there are things that happened in your day. So you might gradually realize that your day wasn't all bad. That is very important to keep your hopes up if you want to get out of your negative mood. The more we indulge in the negativity of your mood, the lower and deeper you go. It's like going down the well. The more you try to get out of it will be the only way to get out of depression. Depression, I feel very bad when people throw it around very easily, like I started off, because I have seen people in depression who struggle with it, who don't feel any day they can fight. So we should make that effort. If you are in a milder stage of depression, or you have sadness, or you have issues that you can't handle for a few days, you don't want to be there, you don't want to go deeper, you have to try to get out. Okay. And most of my audience is I believe are engineers, so I don't have to tell you to think logically. You can use logic as your weapon. It's a very strong weapon to fight your irrational, that little irrational voice in your head that keeps telling you negative things and tries to push you down. Fight it with logic. If you feel your friend, you have texted your friend and your friend hasn't replied, and you're thinking oh my god, she doesn't like me, she's not replying my message. An easier alternative logical explanation could be she's just busy. So, it will be going easy on her as well as yourself. So, and the other simple tips everybody knows, exercise, eat healthy. Exercise shouldn't be taken lightly, because exercise improves dopamine in the brain and helps you to get out of it. Okay, depression primarily is a biological disorder, which is why sometimes you don't need a trigger for depression. It's because of the changes in the neurotransmitters in your brain that you experience that kind of pervasive sadness. Okay, so we have ways to correct that chemical imbalance. And then you have to try to start a healthy routine, which, yes, initially will be difficult to stick to. First, start with fixing your sleep. Try to sleep every day. A well rested brain is less likely cranky like a well rested mom. So you rest your brain, it is less likely to give you pain. And also give yourself graded tasks. Today you did this, okay, tomorrow I'll do a little more, and gradually try to get out of it. And yes, like my previous speaker said, self-affirmative, appreciating yourself, self-talking is very good. Practicing mindfulness is brilliant. Meditation, yoga, all that helps. Add to it. And maintain, last but not the least, maintain a gratitude journal. You know, uh, like I said, writing the positive things, find things to say thank you for what happened on that day really helps. You might feel another feature in depression is that you might feel you're helpless. There's nobody to help you get out of this mess. Sometimes writing this will make you realize, yes, there are people around you who care about you, who really want you to get better. So do these things, most likely you'll get out of it. Don't worry. Then there are people to help you around you. I'm sure Maya ma'am will spot you right around the corner.
I'm sure she has. Okay. How do I cope with anxiety related to exams?
Exams. every student's major problem. Exam, basically, there's no easy way out. Being well prepared for an exam is the best way to tackle an exam. But yes, generally what happens is like previously someone had asked, I put my assignments to my last midnight to start working on them. Exams are not something that you should try to cramp the night before the exam, because generally we remember things when our memory consolidation works when we sleep. So we need a good night's sleep, and what you study regularly is what you're able to reproduce the next day. Many people come to me and tell me, exam, I get so stressed during exam, I totally blank out, I can't remember anything, then I have to sit and I struggle with it. You don't lose memories. You're not a patient with dementia. You don't lose memories. Okay. So anything that you have learned again. For learning, you have to concentrate, be attentive, and make sure it is there. If you put it in a cupboard safely, it will be there in that cupboard. And you have to do it peacefully to remember which cupboard you have put it. These are some of the things that are required while trying to learn. Okay, so you have to learn regularly and revise it to remember that, it is that place where I have put it. What happens is when we generally rush and learn last minute studies, we don't get time to revise. So we don't know where it is. Sometimes it's there in the brain, but we're not able to recollect. For a good, when we study properly, we have to, whatever we have learned has to be stored and recollected properly. Okay, so one exercise that you can do is you can work on, maybe when you're studying itself, you can practice recollection. Like, if whatever topic you studied the previous day, close your keep your book closed and try to think, okay, this heading, what comes under this heading? Okay, this point 3.3, point 4.5, like that. Try to recollect by yourself and then go back and check if you have missed any points. This will help improve recollection. It will prevent blanking out. Okay, and like I said, to avoid last minute cramping, at least by the time the exam dates are out, we have to plan. Generally, universities give at least a month before the dates are out, usually. So at least that 1 month, at least you have to plan properly for your subjects. Preferably, when they are taught, a regular practice of studies really help. And few tricks and treats, if you want, would be to, sit in the same place, study in the same time. All those things improve concentration, because our brain is like an animal brain. You can train it to work. So when you sit in the same place every day at the same time, your brain starts saying, it's time for me to concentrate. It's time for my daily intake of, studies. Just like we go to the loo in the morning, the bathroom in the morning, if you practice it really, you get trained well. Okay. And revision, you can do fast reading instead of, if you're worried you won't have time for revision. But always, like I said, when the dates come itself, put the slots for revision also when you're making the plan itself for both study and revision. And then don't give up. That happens generally for entrance exams. I have a lot of patients who come because they're entrance exam students and they're worried, I'm tired. I've been going through this for the second time and I can't just push myself. No, don't give up, just be positive. I'm confident that you would have learned more the second time when you're revising it. So there's no way it's going out of your head anywhere. It's whatever you have learned is definitely there somewhere. You just have to find it. Okay. And make that commitment today, that from today at least I will go on regularly. That will help prevent anxiety next time. Okay. Can I ask for my next question?
Yes, sure. How can a person with low physical appearance boost self-esteem?
Physical appearance. Beauty, I think, lies in the eyes of the beholder. It's for us to decide whether we're beautiful or not. It says low physical appearance. I don't know who said that, whether it's your perception of yourself or has someone told you that you have an issue with your appearance. Because most commonly what I find, especially among teenagers, is that there might be a slight curve in the nose, which, when the teenager mentions to me, I have to look twice to notice. But the child might, the child or adult or teenager might be really worried about that little crook on the nose, which is barely noticeable. And would keep going on about how can't move on, can't speak to another person because that person might be feeling that okay, the person opposite of me is staring at my nose and looking at my crook and not as obviously sitting there and judging my appearance. No, it doesn't happen that way. So how we think about our self appearance makes a lot of difference, and that thought is what is bringing your self-esteem down. And if you have repeated thoughts, you have to check if you're going through something like a body dysmorphic disorder. What is body dysmorphic disorder? There is not much of a problem with the body per se, but we get really conscious about how we look. Even though I really wish to look like Aishwarya Rai myself, but it's not always possible, no? So we have to make do with what we have. Certain therapies that were mentioned by Ms. Anu, like accepting our thoughts, help us with dysmorphic disorder, along with mindfulness and CBT. And I think accepting our looks really will boost our self-esteem. And plus, nowadays, if I'm a little dark, yes, definitely a foundation of a lighter shade can help. And people with body dysmorphic disorder, lots of them, they go through unnecessary surgeries. They go to they're the people who feed plastic surgeons, literally feed their pockets. So just see if it is really valid, because I don't think anybody is really ugly unless they're ugly inside. So your looks don't matter that much. It's just who you are that matters. Right.
So true. It's inside that matters, not outside, right?
Yeah, I'm sure I would be really hurt if my husband told me 40 years down the line that you're like all gray and wrinkled. I've been with him for so long. It's what's inside that matters, right?
Yes, true.
Yeah.
Okay, so I think this is related to the previous question itself. What all activities can be done for self-love?
Self-love. Nobody asked me what all can be done for falling in love with another person. It's so difficult to fall in love with a person you have been with since birth. Self-love is difficult. Okay. I think generally why we find it difficult to love ourselves is because you know all your flaws, right? Because you don't know anybody else's every flaw or something. We're too judgmental about ourselves. We think, probably, okay, after this presentation, I might be thinking, oh, I could have, maybe done it slightly different. No, I didn't go that well. That's me judging yes, it's important for me to maybe do a little better next time. But sometimes this judgmental nature gets a little harsh. We don't do that to others. Someone does a presentation, you definitely will go tell them, yes, you did a great job. And maybe, yeah, you've added a few more points there. That's right. But what do you do to yourself? Oh, what is this? You were sweating there. Oh my God. I'm sure he would have thought you said all the rubbish things. All your answers were inappropriate. You would keep running this through your head, right? So avoid self-judgment. Start trusting yourself. And always, be nice to yourself. You can sometimes, dress up just to look nice and then, say, you look good. Not bad, huh? Not bad for a 35-year-old. So yeah, so I think all these, focusing on those things that you love about yourself, that not love about yourself, that be quoting the question, that you appreciate, think are good within you, would be the first step. When you fall in love with another person, at least in the first months of the love, you don't notice any flaws in that person. You think that person is like perfect. So try that on yourself. Right.
Right. Okay. I need help implementing a good habit in my life. For example, study daily. but I'm unable to do so. So can you, I think the person needs ways how one can implement a good habit in their life.
Yeah, I've been working on that myself. Exercise is a habit that I take a resolution every year. But yeah, okay. It's an uphill task. Yes, in any habit is an uphill task, except for probably our routines that we've done since childhood, like brushing and all that. Everything else is an uphill task. Okay, so go slow on it. And any habit that has to be learned, we might think, okay, I practiced it for a week or two, and why is it that I'm falling back on my routine? No, to form a habit you need like 21 days to 3 months minimum to, okay, say, okay, you've done something to work on that habit. And the problem with a habit like studies is the reinforcement of that habit is very little. It's not something like, okay, if I want to make a habit of watching a movie episode or a series episode every day at 8 p.m., do you think I'll find it as difficult as probably going to the gym every day at 8? It is immediately reinforcing. It is very reinforcing. And, you know, uh, in the case of the exercise, probably I'll require at least a week to start seeing a change in my, weighing scale for me to get like a pat on my shoulder saying, yeah, good job. But studies is not even like that. You need at least your SEM exams to at least find a difference. So to go on consistently is very difficult because there is very little reinforcement. So you have to yourself set a goal for yourself. Okay, and
Okay.
studies have said that a habit builds better when it is attached to a cue. Like, why is it that we brush? It is probably the only thing that everybody does unanimously correctly. Why do we brush before we, as soon as we wake up? Why is it more difficult, easier to practice brushing in the morning than at night? Though the dentists say it is more important to brush at night. Why is it that we all do that? It's because we have linked to a cue, which is waking up from the bed early morning, go brush your teeth. So it's become a habit because you have related it to something. So try doing that when you're building a new habit. Studies, maybe you can put a pattern, like if you're going to play at 5 o'clock, you're back, you know, at 6. Maybe I take a shower at 6 and immediately sit for studies. So you can cue it with something. Okay.
Okay.
It's more easier for exercise. Like you can put a pattern. Like in the morning, I'll wake up, I'll brush, and then I'll go. So try to do it with something. Then you can put like Miss Anu said, you can put reminders. For reminding yourself about your goal or things you want, done. And sometimes you have to add fun to the whole activity that you're trying to, which is why now people, instead of going to the gym, they prefer Zumba. It's more fun. So another thing that you can try is maybe, okay, we'll complete so much portion. You can decide with a friend. After that, we'll do a group revision or a combined study. That will kind of motivate us because you have a deadline and you have to finish so much. So it will bring about a regular practice where, so many people are involved. Every week you have a group revision, something like that. And obviously at least 60% of the group revision I hope will be productive. So that will be a positive reinforcement. And last but not the least, try to visualize your goal. Like, okay, why I'm doing engineering, I want to get here, have a goal in mind. Yes, that's where I'm trying to reach. Visualize yourself. Maybe if it's a short-term goal, graduating from your college, visualize yourself in that graduation ceremony. A visual image of is a very strong positive reinforcement. Keep thinking, yes, I want to stand there, make my parents proud. That emotion will drive you further. Try working on that.
Okay. Next question. I have commitment issues. I lose feelings for someone after nearly a year after I get into a relationship. And this has happened many times to a point where I hate the person I am in a relationship with and I hurt them unnecessarily. I literally start hating them and feel like I want to get out of the relationship only to get into another relationship later. What do I do and what is the cause for this?
Commitment issues per se can stem from a lot of causes. It can be, issues in childhood where you have attachment issues. I don't know what the rest of the background of the person asking this question is, it can be because attachment figures, you didn't have proper attachments, or it can be because a personality is developing where you have issues with relationships. So that has to be evaluated further, whether there's an underlying personality, or whether it is underlying trauma, what it is has to be evaluated. Depending on that, yes, definitely treatment is available. I don't think I can say further for this question.
I think whoever has asked this question, they can either, consult you or any other psychologist later, right? If
Yeah.
this is required. If any further, explanation is required, I think they can contact. Okay. How do I overcome social anxiety?
Social anxiety. Okay, social anxiety. Basically, social anxiety is something where we feel, when we are talking to someone in public, they're judging us, and they're, evaluating us. You feel, you're constantly monitored. Sometimes you feel people are speaking a little, are they, speaking ill about me? It's like, thoughts are there, and you're like really worried about in public. Sometimes uh, there these symptoms are so predominant that they get their heart rates kind of escalate. They have sweaty palms, and they're not able to focus on what they're not sorry, I got a call. They're not able to focus on what they're saying, and all this kind of makes it very difficult for them to have a normal interaction. Okay. How do you go about it? Some of the breathing exercises. I believe Miss Anu was planning to do a breathing exercise. I guess I didn't let her know. I started off way early. Breathing exercises, relaxation techniques can really help bring down any kind of anxiety, generalized anxiety, social anxiety, or other types of anxiety. So when you bring down this basal anxiety, you'll be able to face most of these. Then another technique is, during therapy, we help guide them with social interactions. We actually do role play, and we kind of guide them with the social interactions, that they feel okay. Now I face it better when I have to do a presentation, or those kind of things. Yes, there are medications also that can help with, um, if it's a performance, like there are medicines that you can take just prior to performing on stage. There are singers who do that. After the performance, they're otherwise okay with every other kind of interactions. So whatever type of anxiety can be dealt with this way. And mindfulness is again something you can practice prior to getting there. You can practice prior to going to a what social situation that you're not comfortable with, and it will cause relaxation. I'll also tell you how everybody takes breathing very lightly, because I find people breathing, I've heard so many times, what is this? Just taking in air and leaving out air. Every day I do it, like, many times. But it doesn't really help. How it works is, basically, when we get anxious, we tend to breathe in and out faster and more. Okay, we tend to hyperventilate, as in breathe more. So when we do the opposite, like we're breathing slowly, we tend to confuse our brain. Is she anxious or is she relaxed? So when we breathe slowly, the brain gets the signal that we're relaxed. So the brain kind of tends to go into a relaxed mode, and gradually reduce our heart rate, and gradually make us go like that. So it is something you should all try, along with other relaxation techniques.
Okay.
Hope that answers the question. Yeah.
Okay, so I have extreme social anxiety when I talk to girls, but not with boys. I'm a girl. What do I do?
Social anxiety need not, yes, sometimes we commonly say that boys have social anxiety when they talk to girls, but yes, girls can also have social anxiety when they see, it depends on the situation where you feel you're judged by someone else, and you have to it says extreme social, is it particular to certain girls is another thing that you have to look, whether it is because of their interactions that you're having a problem, or is it with all the girls. So those kind of things has to be looked into. But yes, regarding social anxiety per se, I think I've answered in the previous question.
Yes. Okay. How to reduce overthinking? I overthink about what people think of me when someone is talking to me.
Reducing overthinking is something that I said earlier also. Like, you can um, make notes of what is appropriate and try to solve one problem at a time. And the second part of the question, overthink about what people think of me when they're talking to me, is again a sign of social anxiety. That is where you feel very judged. So I think you have to work on the social anxiety again.
Okay. What may include sleeping disorders?
Sleep disorders is actually, like, it's a huge topic. Sleep disorders, um, I'm surprised that someone asked something like, what includes sleep disorders, because it's like 2-3 essays for me in my MD curriculum. Okay,
Okay.
basically commonly sleep disorders would most commonly mentioned one would be insomnia. Insomnia is you're not getting sleep, whether it is early, middle, or late. As in early, as in you have difficulty initiating sleep. Middle is you have difficulty maintaining sleep. Late insomnia would be difficulty. You have early wakening. So it can be either of that. And insomnia, as in the sleep difficulty, could be because of psychological difficulties, or it could be because of um, reasons in your brain. Okay.
Hmm.
What is the reason would be evaluated by your doctor. But if it is psychological insomnia, that is what we first rule out. We look for other comorbidities. If there's nothing else, we go for psychological insomnia. The psychological insomnia, okay, he's what may include treatment, I'm not going into. Include other sleep disorders are narcolepsy. For example, narcolepsy is like the person during daytime has excessive sleep. He's probably, if I have narcolepsy, I'm going into this meeting and suddenly I fall asleep. Like few minutes, I'm just like
Oh.
asleep and I lose my tone and I just like go off, like fall off.
Okay.
And other sleep disorders would be breathing related sleep disorders. Like, you have people who snore, like sleep apnea.
Yeah.
That is only due to an obstruction either in the breathing pathway, or it can have a central cause, which because of the breathing issue, the person keeps waking. If there's for example, a obstruction in the nose that's causing the snoring, and the person is not getting breath, he might lightly wake up. You might not notice the person who is snoring as to that he's waking up, but his sleep on a sleep record, on a polysomnograph, which is sleep record, we'll notice that he's waking up at night multiple times. Okay, so
Oh.
that is sleep apnea. Because of lack of breathing, the person wakes up. Then there's this huge class called parasomnias, where okay, very technical life now, where the person sleep is disturbed because of maybe some people have restless leg syndrome, as in the person is sleeping, the person has this urge to move the leg all the time, and that disturbs the sleep. Or they may have nightmares or night terrors, or sleep paralysis, where the person actually wakes up from the sleep but is not able to move the body. It's a very scary this thing, as the person is awake, but for the first few minutes he's not able to move his body. So that is again a sleep disorder. Sometimes the commonly one talking in the sleep, walking in the sleep, all those will come under sleep parasomnias. Then there is circadian rhythm disorders, which is basically where you have shift workers, or when shift workers who are having disturbances in their circadian rhythm, like the normal time sleep, or when we travel, you have jet lag. All of this comes under sleep disorders. I don't think this was the answer that they wanted, but I'm not sure what it was, so I answered the
Oh,
question.
that's yes. That's okay, ma'am. Okay. Can ADHD be treated without medication? And are these safe, as in the medication, safe in the long term?
ADHD, see, generally, psychological or psychiatric issues in childhood, we the dictum is wait, 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 wait with therapy, wait with therapy, wait with therapy, and then only initiate medication, because it's a child. You don't want to start medicines immediately. That is the dictum, except in ADHD. Okay, ADHD is the only disorder where we might recommend medications slightly because of the evidence. Okay, is there any treatment without medication? Yes, we give attention enhancing tasks, especially if the child is really small. We try to give attention enhancing tasks and some of these things to. Oh, I'm sorry, is my network having problems? Am I not audible?
You're audible to me right now.
Okay, so those things can ADHD can be treated with those attention enhancing tasks and all those things, but does it treat it adequately? Not really. If you actually have a proper ADHD, it generally requires medication. Okay, for it to have proper control, because studies have shown that when we compare both, a person on medication generally performs better long term than someone who's, and that again is someone diagnosed with ADHD. I find children come in because of the over information provided by our Google uh, aunt, saying that I can't concentrate. You Google and they'll give you ADHD, and they think they have ADHD, which makes it very difficult for me to diagnose also, because I also get confused after some time. The person comes to me saying the criteria for ADHD from Google, so I have nothing more to ask because they're already saying every criteria. So that's another thing. So are there side effects? Yes, medicines. Those generally ADHD is treated with medicines like methylphenidate or atomoxetin. Uh, they are methylphenidate is a stimulant category drug. Yes, there are side effects, but generally doctors will ask you to stay on regular follow-up and to watch whether any of those side effects are developing. And if they are, you will be changed to another medication, or your doses will be adjusted based on it.
Okay.
On a long term, ADHD also has a lot of side effects. Problem with ADHD, untreated ADHD is a forerunner for conduct disorder, which is where person has a lot of behavioral issues. Conduct disorder is again a forerunner for antisocial personality disorder. So all these, when you look at the comorbidities that a person with untreated ADHD can lead to learning disability. The child is not able to learn properly. Uh, Acquired. Actually, he doesn't have any problem that should actually cause learning disability, but because he's not able to maintain his attention, he might not be learning properly. So a lot of other comorbid issues also come if untreated. So yeah, it requires treatment, and it is not a medicine that you can buy over the counter or should attempt to treat yourself with. No.
Okay. Okay. Next is, could you tell me the effects of a schizophrenic medicine on a person for 10 years? Does it change their behavior and mindset automatically? And do they become dependent on the medicine and worse than what they used to be?
Okay. Effect of a schizophrenic medicine with schizophrenic medicine. See, schizophrenia is a long-term chronic mental disorder which requires long-term medication. Yes. Schizophrenia is not generally when I psychoeducate my patients about schizophrenia, I generally like to compare it with a disease like diabetes. It is not a disease that comes to and goes. It is a chronic disease. It stays. But just like diabetes, you can treat it adequately and keep its symptoms in control, so that the person can lead a very normal life without being affected by it. Um, and schizophrenia on a long term, if not treated properly, it is a disorder of the brain. Everybody has this myth mythful belief that mental health illnesses are of the mind, somewhere here. It's all hocus pocus. No, it is basically your brain that is your mind and everything that you are. So schizophrenia is again a a disorder where neurotransmitters in the brain, their imbalance is causing that person to think differently. Okay, earlier medicines, I had heard a question about a person had asked about the grandmother. See, earlier medications were very less. Probably when the grandmother was young, availability of medicines were very less. So there was just option of giving medicines. If the patient is like really restless, you can only sedate the patient. Those were the few options available. But now it is not like that. Everybody wants to be functional. Nobody wants to have medicines and sit at home just drowsy or anything. So medications are available that let you have your medicine and go to work the next day, work perfectly fine. Over a period of time, schizophrenia per se causes reduction in attention, reduction in concentration, person's thinking abilities change. It need not be directly implicated because of the medication. Usually untreated schizophrenia has a worse prognosis than treated schizophrenia. And about the last part, do you become dependent on the medicine? No. Schizophrenia is primarily treated with antipsychotic medications, none of which have dependence. None of your
Oh,
antipsychotic medications.
okay. What is the easiest way to identify bipolar disorder?
I'll give you my number. Call me. Easiest way would be that. Um, how to identify? Yes, bipolar disorders. If you're asking me, is there a test that you're going to just give your blood and know if you have bipolar? No, there is no blood test. It is a clinical diagnosis. So easiest way would be to go to a clinician. But I'll tell you what bipolar disorder is primarily about. Bipolar disorder is a mood disorder. Okay, everybody knows, I hope at least after my first answer, what depression is. So, depression is a sinking of your mood to the lower spectrum, like you're sad, okay, from your normal range. All of us fall within a normal range of emotions. You have sadness, you have happiness, you have, you're very tired and down, you're happy and up and about. Okay, so there is this range of normal emotions between which you keep fluctuating during the day, during the week, during a month, every day. Okay, but when you have a mood disorder, for example, depression, you go into a dip which is lower than your normal fluctuation, into much lower, and it persists for a long period of time. That is depression. Okay, in bipolar disorder, there is this pole, which is the depressive pole, and there is also the other pole where you're very happy, you're very talkative, you're very energetic, you're all set to make a lot of plans. You make 10 different business plans, and you put your money there, you put your money here, and lose all of it because you're all too optimistic that every business plan will work. You don't think it through. So that's the other end of other pole of your depression. Depression would be where you don't feel like going out of your house. You are everywhere. So that's a manic episode. So that's the other end of the pole. So when both these poles exist and not just unipolar depression, it is called a bipolar disorder. So if you have these mood fluctuations, then it is bipolar disorder. There are different variants in bipolar disorder, but that's too much.
Okay. How to deal with bullies?
I think Maya ma'am should answer that. How do you deal with bullies in college? Yeah, but step one is identifying you're being bullied. That actually everybody in schools and all, there's this image that you hit someone. Physical bullying is very easy to identify because it comes to us naturally. You have this image of a big boy, hitting you there, and he's a bully. Okay, but sometimes what I notice is when we take history, detailed history is only when you get bullying from a person's history. Sometimes there's always this emotional bullying that goes around, even in workplaces. Where the co-worker chuma for fun spreads random gossips, or that is bullying. Regularly spreading negative gossips about someone, or an employer intentionally scrutinizing your one particular employee's work repeatedly, or in a public meeting repeatedly picking on someone, all that also caters to bullying. So it might be emotional, it might be physical, yes, very easy to identify. Sometimes it might be excessive sexist or discriminatory messages in the groups, or that kind of comments. If you are, it depends how to tackle bullying. Depends where you are. If you are in school, talk to your teacher. If you're in, in a college, get help from your, principal or your mentor or whoever is there. If you are working in a company, research your company policy on bullying. Most MNCs and big companies, they have a fixed protocol with these things. And before you talk to anybody else, stand up for yourself and try to themselves if you can do it. What that does to your mental, when you identify he's bullying you emotionally, you would have probably realized he's destroying your mental health. So you have to stand up for your mental health. If somebody takes your property and says, this is my property, this is my house, would you just stand there? Oh, this is your house. This is mine. No? This is yours. You won't stand there. No? You'll throw that person physically out of your house. No. This is my house. Same way, somebody walks over you, makes you feel horrible. It is affecting our mental health. Stand up for yourself. Talk to the bully. Tell him, hold your ground. Say what you ask first. Okay, why you're doing? Because you have to be sure you didn't misinterpret a single situation as as being bullied. If it is continuous, if it is persistent, ask why is it that I have been treated like this in these particular instances. And if that doesn't really help, you can talk to someone about that. Maybe your HR or someone about that if you're in a workplace. And if they ask for, if they're micro scrutinizing your work, maybe you can ask for emails or written, what is wrong in my work? Can you mail me regarding what is wrong? So that will also help you to document and keep some to document and keep proof of the bullying also. If at all, it comes to a stage where you want to take it further. That's another way of, keep screenshots of the messages that are inappropriate. Yet, even cyberbullying is something that is very common. So you have to know that you're being bullied. You can report it. It is not your fault if you're being bullied. It is generally the fault of the bully, because it might be attention-seeking behavior. It might be the insecurities of the bully that is driving that bully forward, or maybe the bully might be having a personality disorder because of which he's doing it. It is not your fault. So you can talk about it to anybody because it's not your fault, somebody else's fault. Okay? So stand up.
Okay, ma'am.
Yeah.
How to get rid of mobile phone addiction? I think this is the last question, ma'am. Yeah.
Yeah. Nobody's asked any questions in the chat box.
Ma'am, I can't see the chat box. Sorry, I've shared my screen, so I'm not.
Yes, they have asked. There is one: how to deal with sudden panic attack.
I'll finish with this question. Someone's getting a call. Okay. Mobile addiction is something that is very trending now. Everybody uses this mobile addiction statement. Sometimes it's just mobile overuse and not addiction per se. Addiction is a very technical terminology. Again, another terminology that you should not use very casually. When you say someone is addicted is when you find it difficult to keep your phone aside even for a little while, when even when during meetings, when you're in a position you're not in a position to look at your mobile, checking it, you feel you don't have your phone with you. So all that might show that you're gradually showing excessive use of the mobile phone. Like before, you used to use for a few hours, and now the duration of use has increased, and despite that increase in duration of not satisfied, you want to use more. So there are so many things that you have to look whether it is addiction. Sometimes people use mobile phones or binge on series on the phone because they're underlying depressed. So that's a coma. So these have to be differentiated. But yes, if you want to cut down your mobile use, digital detox is one of the ways to go by it, where you set limits. You have to set limits. You have apps where they tell you, so many hours of use, so many hours of use. Review your use every day. Check through those apps that you're using appropriately. If your gaming is 7 hours a day, it is not appropriate gaming. You don't have to game for 7 hours a day. maybe people might need to use the WhatsApp or Zoom meeting for larger periods of the time now that everything is online. But otherwise, you don't have to use your Instagram for 7 hours a day. So review your use, see where it is inappropriate, try to shorten those areas where you're using excessively. Then you can start practicing by, when you're going to nearby places, don't take your phone when it's absolutely not necessary. You're going to the shop right next door. Why do you have to carry your phone? We lived that way when I was 15. But now, even for me, it's very difficult. I'll be like, oh, where's my phone? I'm getting out of the house. It's just like, carrying your house keys. You have to have it. So it's not like that. It doesn't have to be a part of your being. You don't have, it's not a part of your body. It is separate. You have to see it separate. So leave it somewhere. Gradually increase the duration that you're leaving it somewhere, especially nighttime. If you want to improve your sleep pattern, avoid using screens, be it the laptops, be it the mobile, be it the TV. 1 hour prior to your sleep, it is not good. Okay, so keep your mobile phones away and keep it away in a way that when you're going to sleep, you don't, the ringing doesn't wake you up, the messaging. I don't have that option because I get called from the hospital, but definitely engineers have that option. So keep it away. So keep it away and stay away from it. So gradually increase that time. You'll be able to work on your excessive use. Addiction is a different category. And if you have underlying depression, that also requires separate help.
Okay, ma'am. I think yes, that's about it with respect to the questions that were asked in the form. Um, I don't know, my ma'am, if there are any in the chat
Yeah,
box.
there was one in the chat box: how to deal with sudden panic attack just before entering exam hall, which may also cause brain fade.
Which may also cause
Brain fade, brain fade.
pain. New terminologies. Yeah, I think they mean that the answer fades away. I'm not sure. Uh, yeah, panic attack. Dealing with panic attacks. Yes, if you're having proper panic attacks, I don't know if it's proper panic attacks because it's a medical terminology. It is a diagnosis. If you're having a proper panic attack, generally you will be experiencing gradually increasing pattern of increased palpitations, that is increased heart rate, sweating. You want to get out of that place. It is almost like a near death experience. You feel that you can't, something is going to happen to you and you're just, you can't take it any longer. And it subsides within, another 5 minutes. So it's like max 10 to 15 minutes. It goes up and then it reaches the peak position and then it subsides. So it follows this crescendo pattern. And you generally say you have that kind of attacks. And we diagnose a panic disorder if you have repeated attacks over the last 1 month. Okay, so if that is there, usually it is quite serious, but I'm assuming that is not there and it is very mild. In which case, breathing is an exercise that will help you calm down, relax at that point. Then there is JPMR, Jacobson's Progressive Muscle Relaxation, which is an exercise that you can yes, you can Google it. There are videos online, but really I would prefer if a therapist sits with you and goes through that relaxation exercise. And that will only help you if you practice it regularly. See, everybody has this thing that, you go to a therapist, the therapist does everything, and you'll be all better. No, it doesn't work like a surgeon. Where you go to a surgery, you just have to, sleep through the surgery and you're up. Yes, you're all good. Surgeon has done his job. No, they don't charge as much as surgeons do. So part of the job you have to do. So you go to a therapist, they will guide you with the therapy, which you have to practice. It is just like any skill. So if you learn driving, you have to practice it properly if you want to be an expert driver. The first day you do driving and you got your license in your home and your father says he has a heart attack, would you be able to drive him to the hospital? Would you be confident driving him to the hospital? No, right? You have to have practiced it adequately to get out of that anxiety and be able to do that. So you have to practice JPMR and breathing exercises regularly to be able to tackle a panic attack at that moment. You can't do it for the first time. Okay, you go to the therapist, learn it, when I have the panic attack, I'll look into it. No, it doesn't work like that. So if you do it consistently, it will help you. Otherwise, you might, if you have proper panic attacks, you might need medication. Thank you. Any other questions?
Guys, any other queries? You can please either unmute yourself or put in chat. All right. So I think that's about it, ma'am. Anybody? Any questions?
Since
All right.
most of the queries are
Yes,
clear, we can wind up today's session.
sure.
Thank you for joining us for this amazing session. It was really engaging and insightful. On behalf of the IEEE Education Society Kerala chapter, we would like to present Anu Suraj and Dr. Femi Abdulla with a token of gratitude in appreciation for your efforts and support.
Thank you.
Thank you, ma'am. Thank you so much for your patient answering of all the queries. I'm sure the people who asked the queries would have got their answers. So thank you so much, ma'am, for giving us your time and your insightful knowledge as well. So thank you so much.
The pleasure is all mine. It's actually fun interacting with youngsters, but unfortunately, I didn't get to see anyone in this online session. But yeah, it would have been more fun if it was offline.
Yeah, I know. I know. But yeah, I mean, the reason we thought of online rather than offline is more people can join in. Otherwise, they have to come to Kochi because there are some people here not from Kochi. So they would have missed out on it. So that's the reason why we thought of online. Maybe after some time, maybe a few months down
Keep
the
on
line, we'll have an offline. Yeah, we'll have an offline. Yeah. All right.
Yeah.
Thank you, ma'am. Thank you so much.
Well,
Thank you.
Yeah, Maya, please make plan for arranging more programs in this
Sure, sir.
fashion.
Sure,
Okay.
sure, sure.
Yeah,
For
this
sure.
is a very beneficial to our student members as well as professionals who are listening to this. Also, is much useful and helpful for understanding things in much a better way. Thank you all for joining our Edsoc Kerala chapter event, and thank you once again. And your Maya, your sister's name, Veena?
Srila.
Srila. Yeah, Srila Menon and Femina and the other speaker of the day. Thank you all. Thank you very much.
Thank you, sir. Thank you so much.
Yeah.
Have a beautiful weekend. Bye bye.
Bye. I think the meeting is closed, right? Closing. We
Yes.
are closing the meeting, right?
Yes.